Hello, my name is Dr. Elizabeth Pavka. I've been a holistic nutritionist for more than 30 years now. Today I'd like to talk about vitamins and minerals and supplements that are not discussed in any of the materials in this course. One of the topics, the first one will be one size fits all versus biochemical individuality. Next, 4 primary reasons why people's health can benefit from taking supplements. Third, how to choose and use supplements using a never choose this or an always choose this format. And a list of what I consider to be the top 12 supplement manufacturers in the United States, plus more interesting information about other related points. Okay, let's begin. In the 1940s, as you know, the U.S. government came out with the recommended daily allowance. Although these were broken down by age and by sex, they were basically a one-size-fits-all if you were in one of those boxes. And then, in 1956, Dr. Roger J. Williams wrote a book called Biochemical Individuality. And this book is part of the list of resources at the beginning of the course. And he was a pioneer thinker in this whole topic. Unfortunately, his book was not very popular. However, in 1998, the book was reprinted with a new preface written by Dr. Jeffrey Bland, who is the founding father of what we now call functional medicine. And then the government came out with others, the adequate intake and the recommended dietary intake and the upper limit. And this alphabet soup of information was still basically a one-size-fits-all within the box of a certain sex and a certain age. The authors of this book, called The Real Vitamin and Mineral Book, this was written in 2007, they presented what they called the optimal daily intake, which was significantly higher than anything put forward by the government at that time. And then there was another group that put out something called the Suggested Optimal Nutritional Allowances, or SONA. And those too are significantly higher than the government's recommendation. And there is a link to that on the list of resources at the beginning of this course. Then, finally, in topic 7, you learned about what I call the state-of-the-art test called the organics profile. This is based on a urine sample that looks for certain waste products in the urine, and based on that information, it can make the biochemist can make a recommendation for certain vitamins and minerals that need to be increased to create biochemical pathways that are just much healthier for that particular body. And so this is the first measure we have of what we call biochemical individuality. And I predict that there will be more tests that provide more information, and it will be tailored to each one of us as the unique person that we are. So, are you one of the more than half of the Americans who take some kind of vitamin or mineral supplements every day? I am. In fact, I've been taking supplements nearly 20 years now, and I believe, actually I know, that people's health can be improved by taking excellent professional quality supplements. Why? Here are 4 primary reasons. First, many people simply do not eat the healthy foods daily and therefore do not get enough nutrients. Consider the nutritional difference between whole wheat flour and refined white flour. Whole wheat flour contains 22 vitamins and minerals. When it's refined, those 22 nutrients are removed. And then we enrich the flour with 5 vitamins and minerals. So according to my arithmetic, whoever eats white flour in the form of bread, pasta, cereals, and the plethora of food products out there made from white flour, is still 17 nutrients short. In other words, deficient in those 17 nutrients that they would have gotten if they had eaten whole wheat products. Second, our soils are deficient in minerals, as Dr. Joel Wallach spoke about in topic 4. So to flesh out this whole concept a little bit, plants make vitamins. We eat the plants, we take in the vitamins, and the body uses them. Plants cannot make minerals. They must get their minerals from the soil. And so if the soil is deficient in minerals, then the plants growing in that soil will also be deficient in minerals. Third, there's a whole lot of information now about all of the toxins that we are exposed to. The most recent figure I read was more than 80,000 different toxins that are found in our soil, in our water, in our air, in our food, and also in anything that we put onto our skin that soaks in. So consider, if we put something on our skin, some kind of cosmetic, and it disappears, where has it gone? Yes, it's gone into the body. So what I would suggest to you is you never put on your skin anything that you would not eat. And the fourth reason is that many substances rob the body, take nutrients from the body to be handled so that they can be gotten rid of. Here's a list of 6 commonly consumed substances. First, antacids. Antacids reduce the body's supply of vitamin B complex, calcium, phosphorus, and vitamin A and D. Antibiotics, again, diminish the vitamin B complex in our body, plus vitamin K, because as you've learned, many of the probiotics produce vitamin K in the gut. Next comes aspirin, which robs the body, here again, this is the third one, robs the body, reduces the level of vitamin B complex. Also, calcium, folate, iron, potassium, and vitamins A and C. Caffeine. How about your first morning coffee, latte? Reduces the level of biotin and inositol, which are 2 of the lesser well-known B vitamins, plus potassium, vitamin B1, and zinc. Laxatives, including herbal laxatives, diminish the levels of potassium, vitamin A, and vitamin K in the body. And tobacco diminishes the amounts of vitamin A, vitamin C, and vitamin E in the body, I think because those antioxidants are required to neutralize the toxins that enter our body through smoking cigarettes. In fact, a long time ago, I read that 1 pack of cigarettes requires 500 milligrams of vitamin C to neutralize the toxins that enter our body as a result of breathing them in. So I would suggest I would recommend that you quit smoking. And if you still are smoking, then I would certainly recommend 500 milligrams of vitamin C for the pack of cigarettes and an additional vitamin C to neutralize all the toxins entering the body. And here's a reminder that if you're taking any kind of prescription medications, I would urge you to talk to the pharmacist to find out the impact that any of the medications you're taking have on the level of various nutrients in the body. This is often called a drug-nutrient interaction. Now, next, here are some important suggestions for making certain that you get better quality, more effective supplements. In other words, what I call guidelines for choosing and using supplements wisely and well. First, you can choose your supplements based on the containers they are in. The B vitamins and the essential fats are very sensitive to light of all kinds. And so you'll either find the supplements in opaque plastic containers. This one's white. Here's another one that's brown. Or they may be in a colored glass container like this one, which is brown glass. Second, you can read the label for some very unhealthy ingredients, which give you a clue that the rest of the ingredients may not be very healthy as well. And these two groups include artificial flavors and artificial colors. So you want to look for the label, for example, to see if it says FD&C blue number 2, or FD&C yellow number 6, or FD&C red number 40. You find those more often in chewable vitamins for children. So be very careful to read the labels on those chewable children's vitamins that are very bright color and wonder what gives them the color. Manufacturers, some of them, the knowledgeable ones, might use beet juice for red color, might use carrot juice for the orange color, might use algae, spirulina or spinach for the green coloring in them. Now let's explore the form of the supplement. The lowest quality supplements are tablets, which cost the less to manufacture. Both tablets and capsules usually contain fillers. Examples include lactose, or milk sugar, which creates bloating and gas in some people. Beware that supplements of the alcoholic sweeteners known as sorbitol or xylitol may also cause gas and bloating in certain other people. Corn and cornstarch, which is often used as a filler, is a common food sensitivity in many people. And remember that corn is one of the top 3 GMO foods. Other questionable ingredients include magnesium stearate, and I hear both sides of this, some saying it's neutral and some saying it's not healthy. Sorbic acid, talc, as in talcum powder, sodium benzoate, and polyethylene glycol, which, by the way, polyethylene glycol is also found in antifreeze. Go figure. Now I'd like to talk with you about some of the least effective forms of supplements. In other words, never choose this form and always choose this form. Alright, so never choose minerals in the form of oxides because they are the cheapest form and poorly absorbed. This group of minerals includes magnesium, calcium, zinc, and copper often. So always choose minerals combined with any of these amino acids: citrate, glycinate, Glycinate, and aspartate. Now be clear that I am not saying aspartame, which is the artificial sweetener. I'm talking about aspartate, which is an amino acid. This kind of combination between the mineral and the amino acid, these are called chelated minerals. They are more easily absorbed because the body absorbs the amino acid and then the mineral just comes along with it. And the mineral and the amino acid is also utilized by the body too. Never choose DL-alpha tocopherol, common form of a supplement of vitamin E. In fact, I teach my clients that DL stands for don't like. The D form is the found that naturally occurs in our foods. The L form is made in the laboratory, and I hear different things about this as well. Some say it's neutral, others say it's toxic, so I haven't yet developed an opinion about that, but I prefer to stay away from it just in case. So always choose D-alpha tocopherol. Now, D-alpha tocopherol is one of 4 tocopherols in the family. And so it's alpha, beta, gamma, delta tocopherol. So that combination of 4 tocopherols is more complete and a more powerful antioxidant than is D-alpha tocopherol by itself. Better yet is an understanding that there's this family of 4 forms of tocopherols, but there's also a family, I call them cousins of vitamin E, that are called tocotrienols, and they have the same name, alpha, beta, gamma, and delta. When you can find a vitamin E that has all 4 of the tocopherols and all 4 of the tocotrienols, then you have the healthiest, most complete, and most expensive vitamin E supplement available. Okay, so never choose supplements that have less than 10 milligrams of any of the B vitamins, including B1, B2, B3, B5, B6, B7 biotin. Okay, I've got my paper shuffled around here, and no, okay, I got my act together. Always choose the B vitamin complex with more than 10 milligrams each. Better yet, choose supplements that contain what I know as the activated form, what your textbook, Understanding Nutrition, calls coenzymes. Those are the same things, activated vitamins and the coenzymes. So to clarify, so the plants make the vitamins. We eat the plants, we get the vitamins, and then the body has to convert that vitamin form from plant form vitamin into an activated form so that it can be used in the biochemical pathways of the body. And it's interesting that we're discovering that due to their genetic makeup, some people have difficulty producing enough of the activated forms and respond well to supplements containing those. Well, I'm going to show you that one later. So anyhow, consider vitamin B2, riboflavin. The activated form is riboflavin-5-phosphate. Vitamin B6 has 3 different forms found in our foods. The activated form is pyridoxal 5-phosphate. And vitamin B9, let me clarify about this molecule. Vitamin B9, the form that comes in our foods, is folate. Folic acid is the synthetic form that's added to foods to enrich them to prevent spina bifida. And it's interesting that some people have real problems converting folic acid into the active form. The activated form is a pretty long word. Are you ready? 5-methyl-tetrahydrofolate. So you know you're getting some top-notch quality vitamin and mineral supplements when you find the activated form riboflavin 5-phosphate, pyridoxal 5-phosphate, and 5-methyl-tetrahydrofolate. Say that quickly 5 times. Roll it off your tongue. Related to this is never choose vitamin B12 as cyanocobalamin because it's a cheaper synthetically formed of vitamin B12 that does not occur in foods. The activated form of vitamin B12 is methylcobalamin. So cyanocobalamin must be converted to methylcobalamin for the body to be able to utilize it. And also remember that vitamin B12 is a very large molecule that requires healthy amounts of hydrochloric acid in the stomach as well as intrinsic factor. So it's a very complex process by which vitamin B12 enters the biochemical pathways. Tablets and capsules are least well absorbed. Sublingual forms, under the tongue forms of B12, are more easily absorbed. And the easiest absorption, of course, comes with B12 injections. And there are some doctors who do functional medicine that teach their patients to inject themselves with vitamin B12. And those patients discover a significant change in how they feel and their energy and so many aspects of their health that it can be a long time process for them to do those self-injections. So always choose methylcobalamin vitamin B12. Now, based on my more than 30 years in this field of foods, nutrients, supplements, here is my list of the top 12 best supplement manufacturing companies in the United States. I'm going to read off this list and I'm going to spell a few so you've got the correct spelling. So, Pure Encapsulations, that's this one. Looks like this, white with a blue label. This happens to be my bottle. And it does have the standard B vitamins and many of them. It also contains many of the activated forms. So that's why I choose that one. Designs for Health. Thorne with an E, Research. Perk, spelled P-E-R-Q-U-E. Claire, K-L-A-I-R-E, Labs. Zymogen, that's spelled X-Y-M-O-G-E-N. Da Vinci Labs. Innate Response Formulas. Integrative Therapeutics. Metabolic Maintenance. Metagenics, and Nordic Naturals. I know of only one wholesale who carries all of these lines of 12 brands of supplements. It's called Emerson Ecologics. I'd suggest that you contact emersonecologics.com to see if you can purchase their supplements wholesale. And if they say no, then email me at drpavka@elizabethpavka.com and request my information about how you can sign up and order them at a significant savings. So my email address is drpavka@elizabethpavka.com. Now, here's a little bit more of an assorted bunch of information. Essential fats like fish oils and flaxseed oils are very unstable at room temperature, and they can become rancid, which means they smell bad, they taste bad, they kind of taste like dirt, and they smell like rotting things. So some type of antioxidant is required in these essential fats. It might be vitamin E that we've talked about. It might be rosemary, the herb, the spice, which has powerful antioxidant properties. Or it might be something called fat-soluble vitamin C, which is called ascorbyl palmitate. It's amazing the things that scientists can make in the laboratory. In this situation, they can take water-soluble vitamin C and convert it into a fat-soluble form and then put it into these essential fats. You also want to read the label to make sure that it says things like molecularly distilled or pharmaceutical grade, or some type of declaration saying it's been through some testing for various pesticides and toxic minerals like lead and mercury. Now, for your information, supplements of essential fats are also available from non-fish sources like flaxseed and also from krill algae. It's called krill oil, K-R-I-L-L. The next topic has to do with yellow urine. There are 3 basic reasons why our urine turns yellow. I have not explored any of the prescription medications to see if they do that. One reason the urine gets very yellow is because a person is not drinking enough water. And I still read, everybody's supposed to everybody's supposed to drink 8 8-ounce glasses of water a day. Well, that doesn't make any sense, because a 100-pound person requires less water, certainly, than a 200-pound person. What I teach my clients is body weight in pounds divided by 2 is the number of ounces of water to drink a day. So someone who weighs 100 pounds needs 50 ounces of water. Someone who weighs 150 pounds needs 75 ounces of water, or 2 quarts. Somebody who weighs 200 pounds requires 100 ounces of water, which is a gallon. So insufficient water can create yellow urine. The second thing that can create it is consuming a bit too much of protein, because when the body breaks down protein for its protein needs, one of the byproducts colors the urine yellow. So you might want to drink more water and eat a little less protein and see if any color change takes place in your urine. And interestingly enough, riboflavin can also turn our urine yellow. And it goes this way. So we eat the vitamin B2 in our food, and we take a supplement with vitamin B2, especially the activated form, which this one has. There it is. Which it has. And so you eat the foods, you take the supplements, the vitamin B2 is in the body, it gets absorbed by the cells, and they get full of vitamin B2, and then the body goes, well, there's a little left over, so we're just going to shuffle it off to the kidneys and let them excrete it in the urine. So I just want you to know about those three causes of yellower urine than usual. Let's talk a little bit more about vitamin C supplements. Some vitamin C supplements, especially the cheaper kind, are ascorbic acid. And some people do fine with ascorbic acid. Other people find that the acid itself annoys their stomach and they just can't take those kinds of vitamin C supplements. So there's another kind called buffered vitamin C, where the vitamin C is combined with a mineral, usually something like calcium or magnesium. The buffered vitamin C does not have that acidic effect on the stomach. Many people can tolerate it much better, and people can use not only the vitamin C, but they can use the mineral along at the same time. Now, in your textbook called Understanding Nutrition, it talks about one of the toxic effects of vitamin C is diarrhea. And I want to reframe that for you so you can get a better glimpse of what's really going on. Yes, that does happen when people tend to take a lot of vitamin C. There's a certain mechanism in the intestinal tract that says, okay, we've got as much as we can absorb right now, and the rest of it, we're just going to let it flush on through with the rest of the bowel movement and come out. Sometimes what happens in that regard is the person will experience a loosening of the bowel movements, or stool or poop as my grandchildren call it. And so this is a really useful thing that you can do, is get some vitamin C that agrees with you, and then slowly and gradually increase it until you definitely see a loosening of the bowel movements. And that's your body saying, that's how much vitamin C we need at this moment in time. See, I believe that our need for vitamin C actually goes up and down. And when we feel like we're coming down with something, we need lots more vitamin C, and we can absorb vitamin C. Or if we're feeling great and we don't have any stress and it's summertime and we're out there getting lots of sunshine, it may be that we don't need so much vitamin C. And so not only can you promote bowel movements by taking vitamin C to bowel tolerance, you can also determine how much vitamin C your body can utilize. So it can be a very useful process to test this out once in a while and see if those levels of vitamin C do in fact change. The last thing I want to mention to you is based on a true story of a collaboration that I had with one of my clients who had had Crohn's disease, I think, for 15 years, a long, long time. And as you may know, Crohn's disease means that the body does not digest and absorb many foods and many supplements. And my client was having problems with her vitamin D levels in her blood. And the doctor had checked her several times, and it seems to me like her vitamin D level was like 20 nanograms per deciliter, when you really want it to be 50, 60, 70, 80. And so I said to her, I said, okay, so vitamin D is a fat-soluble vitamin, so let's do a little experiment. I want you to go to the local health food store and get yourself a bottle, a brown glass dropper bottle of liquid vitamin D. And then what I want you to do is put 5 drops on parts of the body where you have the most fat, because this is a fat-soluble vitamin. And she was very thin. So the best places for her were a little place underneath her arm where there was some fat and on her inner thighs. And she did that faithfully every day for 2 months. And then she went back to her doctor, who checked her vitamin D levels again. And sure enough, it had gone from 20 to 40. It had doubled in 2 months by bypassing the digestive tract and using what's called the dermal application. In other words, you put it on the skin, and you sometimes have to wait 5, maybe 10 minutes, but it will get absorbed. It absolutely will. So you might want to try that for yourself and see what your blood levels of vitamin D turn out to be. Well, we've talked about a lot of topics, and I hope they've been useful to you. And I just want to say thank you for listening. And I want to remind you, eat well to be well. Take good quality supplements to be well. And then you will be even healthier than you might have been with only foods. So thank you very much for attending. Send me an email if I can answer a question for you. And have a great rest of the day. Bye.